Hello, everyone. We are now on the lower appendage. We've already talked about the upper appendage of the arm bones, and now we're going to talk about the leg bones, starting with the pelvic girdle. The pelvic girdle is a lot like the pectoral girdle that we've already talked about. Remember, those are the bones that held the arm onto the axial skeleton. So the pelvic girdle is basically the same thing. So we're going to talk about this bone here, which is called the os coxa. And we're going to talk about all the structures of that and how that holds it on, and then the leg bones themselves. So the femur, the patella, the tibia, the fibula, and then all those bones of the foot. So when we talk about the pelvis, there's several different layers of structure that we could be talking about. Let's start with the first one, a bony pelvis. So a pelvis or a bony pelvis, when they hear that word, what they're talking about is everything put together. And that's going to include the two os coxae. Okay, so here's one os coxae. The two os coxae put together plus the sacrum in the middle. Now the sacrum would be part of the axial skeleton because it's on the axis. But when you're talking about a pelvis, you create the whole pelvic circle right there. And so that's going to include both os coxae bones put together, plus the sacrum in the middle of that. And so if we say the pelvic girdle, what we're talking about is two os coxae bones coming together to form this structure here. And so this would be part of just appendicular because you're missing the sacrum in the middle. Okay, so this is the pelvic girdle, which is two os coxae bones together. And then the os coxa, so remember os coxae, that is plural, more than one. Os coxa is just one hip bone. Okay, so when you look at this, os means bone, coxa as in coxal region means hip. So this is hip bone right there. Now the os coxae itself is actually three bones fused together. We have the ilium, the pubis, and the ischium. So up here, what you think of when you put your hands on your hips, what you're touching right there is this part right here. So this area here, this would be the ilium. So the top part with this kind of wing of bone here, that's the ilium here. And then in the front, in your pubic region, would be the pubis. Okay, so pubis is anterior. And then in the back is the ischium. Now, when you sit down, like when you sit down on a chair, what you're sitting on is your ischium. So I kind of just call it your butt bone, right? So you have the pubis in the front, the ischium in the back, in the posterior, and the ilium on top, superior. Okay, so let's go ahead and get left versus right out of the way. As always, as we already saw when we went through the arm bones, when you're doing left and right, you really need to think about orientation. That's how you're going to get there. Okay, so the way you can do left and right for the os coxa is by looking at how the bones are oriented, right? So the first question is anterior versus posterior. Right? So we already said that this is the pubis, and the pubis is going to be anterior. So this is going to be the front, and the ischium is your butt bone, and your butt's on your back, so that's going to be the posterior side. Okay, so anterior side and posterior side. Now, when you're looking at the pubis is going to have this structure here that's called the pubic symphysis, and it makes like a very kind of square structure. So that is the pubis, whereas the ischium is more lumpy. It's got the, it's more rounded here. So that's the ischium in the back. Okay, so if you put the pubis in the front, ischium in the back. So we're looking at the, here's the front, here's the back. So we're kind of looking at this picture, kind of looking at it from the back. And then the second question we ask ourselves is medial versus lateral. And when we're looking at medial versus lateral, what do we want to look at? See this right here? This is the socket. I'm going to tell you the name of it in a second. This is the acetabulum or acetabulum. This is the socket that the femur is going to fit into. Okay, so if this is where the femur connects to the body, is this socket here, the acetabulum or acetabulum, is this going to be on the medial side or the lateral side? It's got to be the lateral side, right? Because if your leg is going to be connecting to it, your legs are going to be like on the outside, not dangling off in the middle. So this is going to be the lateral side. And then the side with no acetabulum or acetabulum, that is going to be on the medial side. Okay, so if you have your pubis in front, your ischium in the back, and your acetabulum on that side, this right here, this would be the left. Okay, now let's look into some of the bone features here. For the bone features, let's look at if we back up to the ilium, that's this top part here. The ilium is going to have a crest running along the top of it. Okay, so this is called the iliac crest. Iliac crest along the top. A crest is just a ridge. So when you put your hands on your hips, what you're feeling is that iliac crest right there. And then the shallow sink basin-like depression here, that's a fossa. That's a fossa on the ilium. So this is the iliac fossa. That's that depression there. And then when you're looking at the auricular surface, now the auricular surface is going to be on the medial side because that is the surface that is going to articulate with the sacrum. Okay, so see this L-shaped rough kind of this patch right here? That would be the auricular surface of the ilium. Okay, so please note that I did not say articular. It does articulate, but is not the articular surface. It's the auricular surface. Auricular surface. Okay, so that would be where the sacrum is going to articulate, just like that. Okay. You'll have a corresponding one on the sacrum as well. Okay, the next one is the greater sciatic notch. Okay, so what's a notch, again, is like a cutout, like going snip, 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 snip. So you have this cutout right here. This is called the greater sciatic notch, and it's called that because that is where the sciatic nerve is going to exit and come down. It actually runs along the back of your leg, all the way down the back of your leg. Okay, so this big cutout right here that allows the sciatic nerve to exit through, that is going to be the greater sciatic notch. And by the way, when you have a greater sciatic notch, you do also have a lesser sciatic notch, which would be this one right here, but I don't think that's on your list. Okay, so this big one here would be the greater sciatic notch. Okay. On to the ischium. The ischium, again, that's your butt bone. That's what I call it. That's the one in the back. And remember that the pubis will be a lot more kind of angular, and the ischium is more kind of, see how this one's angular, this one's more kind of lumpy and kind of rounded. And that lumpy rounded bump is going to be the ischial tuberosity. Okay, so the ischial tuberosity, a kind of large spread out bump is a tuberosity, and it's on the ischium, so that's the ischial tuberosity. Just make it into an adjective, and there you go, ischial tuberosity. That's this one right here. Okay, so ischial tuberosity there. For the pubis, this angular part of the pubis, that's where the two pubic bones, the two pubis bones meet together. And so that's called the pubic symphysis. The pubic symphysis, because symphysis means meeting, and so that's just where they come together. That would be the kind of square place, the square bone feature right here in the very anterior part of the os coxa. Okay, oh, by the way, the superior and inferior rami just means branch, and so that would just be the part that sticks out to create this big hole. And this big hole that's created from both the ischium in the back and the pubis in the front, that's called the obturator foramen. Obturator foramen. Now be careful, some people try to put an R in there and call it the obturator foramen. There's no R, it's obturator foramen. And the story I've been told to kind of remember that is that when you have the whole body put together, you wouldn't actually be able to see through that hole because there would be layers of muscle covering it. So it's obstructed. The obturator foramen is obstructed. Okay, so but that's this one right here. And again, this one right here, this is the acetabulum, which is how I usually pronounce it, but a lot of people say acetabulum. Again, however you want to pronounce it is fine with me. And that's going to articulate with the femur. That creates another, switch my hands. Yeah, it creates another ball and socket joint that allows for a lot more movement. So we'll talk more about that when we get to joints. Okay, that's the acetabulum or acetabulum. Okay, let's go ahead and test it out. So what I would like you to do is go ahead and pause the video and see if you can answer A, B, and C. What are those? Okay, so when you are trying to identify bone features, the first thing you need to do is orient yourself. What exactly are you looking at? Okay, so we know we're looking at the os coxa. What we now need to do is what orientation are we looking at? Okay, so what I have right here is this one right here. And so when we're looking at it, are we looking at the medial side or the lateral side? The medial side or the lateral side. So remember that this structure here, this is the acetabulum, that's where the femur is going to connect. And so this would be the lateral side. And so what we're looking at right here is the medial aspect of the os coxa. And if you orient it right this, so that would make, that means that this is medial here. So it's an L-shaped structure, that is the auricular surface. Auricular surface. Okay, and so B would be the ischial spine. That's the structure, this part that sticks out right here. Okay, that would be in the back. Okay, so that's posterior, ischial spine. And then C, coming at you, that is a flat surface there, and so that would be the pubic symphysis. The pubic symphysis here. So auricular surface, ischial spine, pubic symphysis. Okay, so now let's talk about male versus female. So when we're looking at this, we're going to be looking at the pelvis, the bony pelvis, so all of it put together. And so when you put the bones together, you're going to make a circle, right? So you have what's called an inlet, so a pelvic brim or a pelvic inlet, which is the circle that's created, the kind of circular structure that's created when they're all put together. That's the pelvic inlet. And then you also have a pelvic outlet, which is the circular structure on the other side that maybe a baby would go through. So thinking about male versus female, remember that females, you know, we give birth. And so we're very, very specialized to make sure that we give birth. And so we need to make sure that that pelvic inlet and the outlet are nice and big. So it's not very obstructed. So as the baby's head is going through, it can fit through. Okay, so you're going to have a small, for males, you'll have a smaller pelvic inlet. And for females, it'll be broader, which allows to create a bigger pelvic inlet there. Okay, so that's, you have a whole kind of spreading of the hips there. And along with that, if you look at the ilium here, this part of the ilium, which you don't need to know, but that's called the ala. That's the wings of the ilium. The ala for males, instead of being flayed outward, it points further up. It's more vertical and it's shallower. It doesn't stick out as much. And this is why females tend to have larger hips than males, because the ala of the wing of the ilium stick out further and stick out longer. Okay, so they're going to be wider and more shallow like this. Okay, so they kind of, instead of being more vertical, they're more shallow like that. And then the other thing that's different is if we look, here's the pubic symphysis, so the meeting of the pubis there. With the pubic symphysis, underneath the pubic symphysis, you create a triangle shape there, right? That's called the pubic arch. Okay, so here is the pubic arch right here. For males, the pubic arch is pretty narrow and it's much more triangular. For females, it's because everything's kind of spread out, it creates a much broader, more U-shaped arch, pubic arch there. So it's going to be greater than 90 degrees there. And so when you look at it, for example, let me put this one together here. Is this male or female? This is definitely male. And just out of, you know, female frustration, most of the time models and pictures will be male, but anyways, so you create a much more triangular, more narrow pubic arch. Okay, so again, the pubic arch is this shape that's created when the two pubic bones meet. The other thing is, remember that the baby has to go all the way through, so it's not just even about the inlet, but the exit as well. And so when you look at here, there's the pelvic outlet right there. And for males, because no baby head needs to go through there, the sacrum is going to be more curved. And on top of that, the coccyx is going to be longer and straighter. So I'm looking at my coccyx. Okay, so again, the model that I have is male, so it'll be nice and curved, and it'll have a long coccyx that's going to stick out into that pelvic outlet. Okay, so male. Whereas females, the female is going to have the straighter coccyx, so that it instead of curving in, that would interfere with the path of the baby, it'll be straighter down like that. Okay, and then again, that's just to allow for the baby's head to go through. So let's try this out. Okay, oops. Is this a male or a female bones, and why? So go ahead and pause it and figure out some words that you could use to explain whether or not this is male or female. You list some specific bone features involved. Okay, we'll go back. Okay, so if we're looking at here, the first thing I notice is look at this sacrum. Here's the sacrum, it's more curved, and look at that coccyx. The coccyx is definitely sticking out. Their pelvic outlet is going to be really small. There's no way a baby's head is going to stick and go through that. Okay, so that definitely screams male. Okay, so we've got our curved coccyx. And another thing is look at the pubic arch. Here is the pubic arch right there. It's very triangular, pretty narrow. That's for male as well. And the other thing is look at the ala. They're going pretty straight upward, right? So they're not splayed out like that. They're much more vertical and longer upward. So that also says male. And like I said, most pictures and models are male, just because of the world we live in, but I might use some females or males on the practicals or the lecture exam, so make sure you're able to answer this question for realsies. Okay, so we're gonna move on, but let's just give you a little teaser here. So the cerebellum, what bone fits in there?